Today we're going to be going over the post-operative rhinoplasty taping that we'll have patients do on a daily basis. Some of the basic supplies that you're going to need are going to be this brown paper tape, which can be picked up at any CVS pharmacy, a pair of scissors, maybe some tweezers. These are very useful when doing this. This product that's called Mastisol. It's a medical grade adhesive that can be applied directly to the skin. Oftentimes we'll have a little medicine cup that I can pour some of that Mastisol in, as well as a Q-tip. So we first begin by getting the skin prepared. After you've taken all the previous day's nasal taping off, you'll want to wash the nose with a warm cleanser. Any type of gentle cleanser would be fine. And then we take some of this Mastisol and we apply it directly to the skin here. This is going to ensure longevity of the nasal taping over the course of the day. Sometimes oily skin can contribute to this coming off, but this latex adhesive will ensure that the tape stays on throughout the day. We're just putting a thin layer over top of the skin. And as you can see, I'm putting it on the nasal tip, on the undersurface of the nasal tip, as well as the nasal sidewalls here onto the cheek, and going up onto this portion that's called the radix as well, because we're going to be taping all those areas down. So the next thing we're going to do is we're going to be preparing our tape strips. So I've taken our brown paper tape and I've attached it here to the side of our tray, and I'm just going to cut them at different lengths. So now that we have several pieces of tape that we can use, the very first taping we're going to do is going to be along the nasal sidewall. So it's going to be a U that's going to start right up here by the eye. It's going to come all the way around just like this by the other eye. And what we're doing is we're securing the nasal sidewall here. And then what we'll do next is right underneath the nose, we're going to pinch this so it creates that nice uniform nasal tip support that we need. The next piece I'm going to utilize is going to be to help with the radix. I'm going to start it right at the area of the super tip break. So if this is the nasal tip, that line just above is called the super tip break. That's about where I want to start my nasal taping. I'm going to put that right over top, and I'm going to carry it directly onto the radix. Sometimes it's beneficial to apply just a little bit more of the latex adhesive for our next set of tapes that are going to secure these struts, if you will, in place. So our next piece of tape is going to go directly over top, just like this, locking those dorsal struts, if you will, right onto the sidewalls of the nose. And keep climbing our way up, making sure to get as even as possible on both sides. As we get closer to the radix, or to the root of the nose up here, what we'd like to do is cut a piece that's going to go right in between the eyes, but not get in the way of the eyelid. So this is going to be a short piece that's going to go right here over the center. And I have two additional pieces of tape. I'm just going to use that to further secure some of this other stuff that we've done down low. And then the last thing is I'm going to trim the tip. If need be, if we don't want that little tail hanging, we can also put a small strip of tape to secure that. And sometimes what I'll do is I'll take this and cut it just down the middle, just to make a small strip wide enough to keep that tail from hanging down below your nose. Now this tape can stay on for 24 hours and be taken off the following day when you're showering. The other thing that we'll ask patients to do is often do nasal rinses throughout the day with just a normal saline rinse that can be sprayed directly up the nose to keep the mucosa moisturized and to prevent any development of cephal perforations or inflammation subsequently after their surgery. So this is how we do our nasal taping. We'll ask the patients to do this every day for 3 weeks following your surgery. If you have questions, feel free to give us a call. We're happy to answer them.